Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Hello, everyone, and welcome to another episode of I Am You. Today, I am so excited for our guest. We have Vickie with us today. Welcome, Vickie. And I am, that ever since we had the opportunity to meet, the worst case scenario at the hospital, I want you to share your story with the world. And it just happened that this was our first opportunity to do it. And the reason why, so the women that are listening to us today, why I'm so especially excited about you here today is because, like you are the typical example of a woman that if didn't got the right diagnosis in the right time, could have been buried a long time ago and wouldn't be here, not only enjoying her life, but also family having the opportunity to have you around and you enjoying the family as well. So when I talk about heart disease and we talk about the life that heart disease claim, and we emphasize the importance of getting checked. And whenever I use this statement, a clean coronary angiogram doesn't mean that your heart is okay. You are the perfect picture for that. So I want you to share with the audience your story of the first time that you went to the hospital, what happened there, and keep moving on the history until we met, and then we will help the audience understand the mechanism of your condition and what is it that we're trying to teach them. Okay, so go for it.
Okay. I was having some issues with, actually, my shoulder was hurting. And then I started having some indigestion, and that went on for a few days, and I decided I needed to go to the hospital. So when I got to the hospital, they did an EKG, and the EKG was perfect.
Normal.
But my troponins were off the charts. They were like between 600 and 700. And they told me I'd had a heart attack. And I was like, oh no, that's impossible. I'm a very healthy person. And
I'm gonna make you pause in there for a second. In your case, you did went to see medical care.
Yes.
No? Because like you, many other women would go through that and then they don't seek medical care and they want to put it off and think that it's something else but their heart. Mm-hmm. But you did go to see medical care because you were feeling that terrible. Because for a woman to go to the emergency room, I know that it takes a heaven and half the other heaven. Yes? But you did not thought about your heart?
No,
when you were,
I did not.
What did you thought was going on?
I thought maybe I was having a gallbladder issue. I thought I was having some kind of issue that I needed to go. And like you mentioned, I had put this off for a while. I had been having some issues for a while, but it just continually got worse and worse. And so...
Oh, so that was not the first day that you were experiencing those symptoms?
No.
For a while, you were getting like this indigestion and the shoulder pain?
Mm-hmm. Mm-hmm.
Oh, but it just go away.
It would go away.
Okay.
So anyway, they admitted me to the hospital, and they ran tests. They did a heart cath, and the cardiologist met with me, and he said, you obviously have not had a heart attack because you have no blockages.
Although your cardiac markers, which is what you mentioned earlier, my troponins. For the audience, troponins is a protein that we can measure on the blood and a blood test. And when we suspect that somebody might be having a heart attack, then we look at that marker. We call it a cardiac biomarker. And troponins elevated tell us there's an injury to the heart. to the level that your troponins were elevated were clear that there was a heart attack. Now, they do a coronary angiogram. The cardiologist is telling you, no, you didn't have a heart attack. Your coronary angiogram looks normal.
Everything looks normal. I was there for a couple of days. They run some additional tests to see
Trying
if they
to understand what else could it be, because it is definitely not the heart.
It's definitely not the heart. So after a couple of days, they determined that, or they assumed that I'd had COVID a few months before, and they decided that it must be where I'd had COVID. And they had mentioned that COVID creates problems with your lungs. It can create problems with other internal organs. And so they released me. No medication, no nothing. I go for a month, almost exactly a month. And on a Friday...
Were you experiencing the symptoms during that month?
No.
They kind of like went away after you went to the hospital. They did whatever they did there, and then kind of like a few more weeks back to semi-normal?
Back to semi-normal.
Okay.
Mm-hmm. I mean, I'd have a little uncomfortable, maybe be a little uncomfortable, but just think, well...
They already told me everything was okay.
They've already told me everything's okay. So, I'm not
Then everything must be okay.
I'm not as young as I used to be, and I put on a little weight, and I just thought, okay, I must be okay. So, again, about a month later, I am watching football, and I'm laying on the sofa, my arm's hurting, my neck starts hurting, my ear starts hurting. I feel like I've swallowed cotton balls. It's like I start getting this enlargement, feels like, in my chest. On my chest.
That's the first one that I hear.
Yeah.
I feel like I swallowed cotton balls. It's like an expansion. Something was expanding in there.
And I got up and went into the bathroom and took my underclothes off because I thought,
they feel tight?
My underclothes are too tight. So I took my...
All of a sudden.
my underclothes.
Imagine the stories that we're making about. All of a sudden, this is a little too tight.
Yeah.
Okay.
So I go back in. I start watching football again, and I'm laying down. Then I sit up, and then I sit up a little bit straighter. And my significant other looks at me and he goes, "Are you okay? Because you've got this strange look on your face." And I go, "No, I'm not okay. You need to call the EMTs." And so he does. And it seems like it took forever for them to get there. And I know they were there in 5 minutes, if it was that long. And they get there, and I'm just, I'm still thinking that I'm having some kind of other issue. Maybe it's gallbladder. Maybe I'd played golf on the Friday before, and I thought, well, maybe I'd
maybe
my shoulder.
The potential explanations that was happening.
But it was getting more extreme. And my extremities started locking up. My hands started locking up. And I felt like not cramps, but my legs felt uncomfortable.
Your entire body was already sending you a lot of signals.
Yes. So they questioned me on the way to the hospital and determined that they need to give me some medication. Which they did, but they, questioned me about all kinds of different things, and I thought these are all strange questions, but they got me to the hospital, and they told me, I asked them what my troponins were, because I knew to ask about that, and they said 2,700.
Was that based on your initial experience?
Yes.
That you know about the
that was because I kept thinking, So,
Got it. You definitely knew something was wrong. Still don't understand what it is. They already told you it wasn't your heart, but you're like, this doesn't feel right. And then asking for the troponins, hopefully they were normal. Were you expecting to hear that your troponins were actually 3 or 4 times what they were the first time?
no, I did not expect that.
So what came to your mind at that moment?
Well, I have a friend who has been seeing you, and she had told me. Even before you went to the emergency room the second time. She's a nurse. And she told me, she said, Vickie, you're just in denial here. You got heart issues. And I go, oh, no. I saw a cardiologist.
They did a cath, and they told me that everything was good.
And everything was fine. And she goes, you need to see Dr. Alvarez. So I immediately, when I got to the emergency room, asked to see you. So, and if I hadn't, I don't think I would be here today.
So when we met at the hospital, that was about 3 years ago. When we met in the hospital, and the first thing that I asked you, definitely this is a heart attack. You share with me that they already have done a coronary angiogram not too long ago. That coronary angiogram was done at another hospital. So we get those records. And then I ask you what medications they send you home with, because it was clear that you had a heart attack in the initial visit. And so I asked you what medication, and you said none. And then for me, that was like, this is what I live and breathe for the world to understand that our conditions are different, that our disease are different, that we cannot assume that there is not a cardiac condition because the coronary angiogram was normal. It was clear that you had a heart attack twice. And the reason why you have a second heart attack was because you did not receive treatment for the medical condition that you have that causes your initial heart attack. So now we speak more about a condition called MINOCA, MINOCA. Myocardial infarction with non-obstructive coronary artery. That's what you had. I had a heart attack, but my arteries are open because my mechanism is not plaque, it's dysfunction of the coronary arteries, which there are different mechanisms for that. It can be spasm. When you have a spasm, you're creating a blockage, but the blockage is transient. So when we take a picture, and if it's not spasming at that moment, we won't be able to see it. Yeah, so then it has to be happening at the moment for us to be able to see it. There's other mechanism like dysfunction of the vessels, the arteries are not relaxing properly. But if we stop at that injection looking at the arteries, we will be missing a lot of women like you where supposedly everything is okay, and then COVID era, which serve to blame anything into COVID, then we keep walking around. And in your case, I would say, even though that moment when you were playing, watching football, it was scary, it was a blessing for you that it happened again. It was a blessing for you because many women like you will go to sleep, take a Tylenol, take an ibuprofen, go to sleep because they were told that their heart is not a problem. And those are the mothers that the next day don't wake up. Those are the mothers that when the spouse go to wake them up, they're dead because they assume that their heart were okay because somebody told them that the heart was okay. No, so that is actually why my bringing you here for me was so important, because the audience, those women that are connecting, synchronizing with us today, they're listening to this, and I want them to be like, how can we drill this in their minds that our disease is different, that we cannot settle for everything looks okay if you are not feeling okay. We initiated treatment, and as I explained to you at the beginning, it is a journey. Like, we got to implement some therapies. It's all about medications. There are some things that we can do as well besides medication, but it's kind of like going in chapters. Okay, let's start this, evaluate. How do you feel? Evaluate. And after you got into the appropriate therapy, including ECP, because you did ECP.
I did.
For those that don't know what ECP is, there is a podcast where we actually talk about ECP. So I would love for them to connect to, so they can listen to what is that really. But it's actually part of the treatment for patients with your condition, where we can help the heart, arteries and the heart relax better and build up new vessels. How do you feel now?
Much, much better. I couldn't walk to the end of my driveway. And now I walk 3 times a week and walk away the pounds, and I play golf. Not very good at it, but I play golf.
That means that there's more exercise.
I have
there.
a golf cart and I have the outfit. Now, I don't know whether that's called playing golf or not, but anyway, I do that. So much better.
So you had an angel also in your path, which is your friend. Your friend saw you, and it says, Vickie, you have a heart problem. Like, you cannot just pretend that it's not there. Mm-hmm. And for women like her, and is what more women like her is what we need in our world. So the ones that are listening should become her. Like, I heard this story. We are different. What you're experiencing is not normal, Vickie. And then, of course, human nature. We do not want to hear that we have heart problem. But at the same time, isn't it so liberating when you know what you have, number one, and number two, because once you know what you have, you can treat it. And then the quality of life that you recover, because who wants to continue having all those random episodes the next time you're playing golf or the next time you're watching TV with your significant other, and you never know when one of those attacks are going to come and if you will survive that.
Exactly. Well, every gal that I play golf with has heard this story in more detail.
She kept some things for herself
and over again. And to the point that I just lectured a gal the other day. I mean, seriously lectured her that she needed to not just listen to her general practitioner, but that she needed to come and see you.
Because you know that her story, as you listen to her story, it sounds like a story of somebody that is like, don't settle for that. Like, they're telling you that everything is okay, but no. I have experienced that, and I have heard that story. Now, there are women in our audience that are listening to your story today, that they are experiencing symptoms like you did, indigestion, a little bit of discomfort here, or they have their mother that have mentioned that they're having symptoms. What would you tell them?
I would tell them they need to get to the hospital. And certainly if they're in this area, they need to ask for you. Because you understand what's going on. I mean, when you've sat with a cardiologist that tells you you have not had a heart attack, and you had, and I was trusting that my doctor knew what was going on. And when your cardiologist doesn't know, and I've changed general practitioners because I didn't feel like they knew.
I laugh because I cannot even imagine when you said, if they're in the area, they need to come to you, and I'm like, okay, extend my schedule. No, but I'm gonna reflect on that, and I thank you for saying it, because another very important message that I want our audience to take is, number one is, there's gonna be always a provider that can serve you the way you deserve. You just have to make sure you're looking for that provider. Unfortunately, we are way behind in understanding heart disease in women, and there is a lot of specialists that are practicing in women's bodies, not understanding us, and they are treating us like little men. No, so if you are in front of one of them, definitely move out of there. Yes, but also, it's my hope that with this type of events, podcasts, my educational material, my book, my documentaries, that every woman understand this, that you might be in front of somebody that doesn't even understand your body like you did, but also that every woman at some point in their life can get in front of somebody that knows exactly what is happening with them without being a matter of luck. Because you and I coincide in this beautiful place called Florida. But not everybody is here. And I want for every woman that is listening to us everywhere to have the opportunity to find somebody that is receptive to the differences that women have, to our differences when it comes to heart disease and how to treat a woman with a heart condition. So I hope for every woman to, like you, Vickie, to have a Dr. Alvarez in their lives.
I do.
And even if it's not me, there are Dr. Alvarez out there. So you just make sure you have to look for them. Okay?
Exactly.
And I am so grateful that you listened to your friend and that you decided to say, I'm just gonna give it a shot to that doctor. And I'm grateful for you to be here today because it means so much to me. It means so much to me that you decide to say, yes, I'm sharing my story to save other women's lives.
Well, it's important. That's the reason I'm here, is because unless you've experienced it or you possibly think you're not experiencing it and you don't,
Thank you.
listen to the right doctor.
Thank you.
Then you're not
Thank you, Vickie.
going to be here.
But you're going to be here for many years to come.
Yes.
Until you get good at golf.
Until I get good at golf. And then I'll be at golf every day.
And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.